Cancer is a disease in which abnormal cells divide uncontrollably and destroy body tissue. Most common include breast cancer, cervical cancer, prostate cancer, among others. Treatment for cancer is usually unaffordable, and to alleviate the hardship, especially from indigent patients, the federal government introduced the National Cancer Health Fund, domiciled NICRAT. The Director, Clinical Services, Professor Musa Gombe, speaks on the mode of disbursement of the fund.
This fund is not a fund, it's an indigent cancer patient fund. It's not a general cancer patient fund. So there is a process, you will have to assess. So, and in the pilot, it is for breast, cervix, and prostate. Some patients apply that are not for breast, cervix, and prostate. They were also not approved, and they also have to pass through that criteria. That criteria means the physician needs to review that he's convinced that the cancer patient has a high prostate, breast, and and then move to the next stage of social assessment. That social worker needs to also review and assess and confirm that this patient is an indigent patient before it moves to the mother. Some patients will also be dropped there, and then it now moves to the multidisciplinary team meeting. The 22 meeting will decide, does this patient deserve to have this fund? Does this patient deserve, what kind of treatment modality does this patient need to have? So all those things are also, some patients will also be dropped there. And then the CMD also approves. CMD needs to confirm that this patient is in his own hospital and is truly an indigent cancer patient before it comes to the level of NICRAT. At NICRAT, we have also made assessments, especially for all of these old applications that we have seen, to confirm what is happening.
He says patients can only assess up to the allocation budgeted.
Isn't it? So we also have the issue of what is appropriated in the budget. So at any particular point in time, you can only utilize the amount that is appropriated as for the fund, for the approvals for the patient. And that is what we are also, taking the advocacy to all stakeholders for the improve of funding for the National Cancer Health Fund.
Joseph Kadri, ITV News.